Hey YouTube, in this video we're going to be discussing the treatment of meningitis. This is going to be a very quick introduction to the pharmacology of the treatment. And actually we're not going to be mentioning any drugs by name because this is just an introduction to help you start thinking about how we approach treatment or therapy for something very serious like meningitis. So let's start. Okay, so first of all, what is meningitis? Meningitis is the inflammation of the meninges covering the brain. So when we see the suffix itis, this usually indicates inflammation. And meningitis means the meninges are inflamed. Now, the meninges are three layers that cover the brain and spinal cord, but in this case, we're specifically talking about the coverings of the brain, not the spinal cord. And you might have heard of them. They're the dura mater, the arachnoid, and the pia. And we're probably gonna do a separate video for in terms of anatomy, but this is very briefly what meningitis is. Now, what causes meningitis? So we have actually, let me zoom out. So there are infectious causes and there are non-infectious causes. So the infectious causes include the viral causes, bacterial causes. And in terms of bacterial, we refer to it as septic or pyogenic infection or inflammation. And chronic bacterial infection like tuberculosis, but this is not pyogenic because this is a chronic disease, and also fungal. And for non-infectious, we have many things can cause meningitis, like certain antibiotics, non-steroidal anti-inflammatory drugs, some immunosuppressants, and potentially cancer. So, yeah, as I said before, meningitis can be septic. This means there are leukocytes in the CSF. When we do an investigation, we can find many leukocytes in the cerebrospinal fluid, and non-septic like the viral and fungal, and obviously the non-infectious, as we said. Okay, so types of treatment. Now, this is the important part, where when we think about the treatment of meningitis, we can talk about the empiric treatment or the targeted treatment. Now, empiric is a treatment that we initiate based on previous experience with meningitis. Based on we don't have specific information yet. We can have broad history, but we don't know exactly what the cause of the meningitis is. We know there is meningitis, but we don't know what organism, whether that be what specific species of bacteria or virus. So this is empiric, and we judge the treatment based on a clinical picture where maybe we can see meningism, which is a set of signs and symptoms that indicate there is meningitis. For example, neck stiffness combined with photophobia and other signs can indicate there is meningitis. So we can start empiric treatment right away, because this disease is very critical to the survival is very critical to the initiation of the time of initiation of the treatment. Now, for targeted, we can also this is based on culture sensitivity. So, for example, we identified it's bacterial, so we can use a CSF sample. We can do a lumbar puncture and take a CSF sample, and then in the biochemistry lab, we can identify the specific organism, and then we can discuss further specific treatment. Lastly, we're going to be talking about the factors that affect the treatment. We already mentioned the timing of initiation is very important. So if we diagnose it very early, we can start with the empiric. But there are other specific factors that could be specific to each patient. For example, if they have a history of a certain drug allergy, then we cannot use that drug. If they have organ dysfunction, then some drugs might be contraindicated. Age is also a very important factor because typically certain factors, certain causative agents for meningitis are more common in age groups than in some age groups than others. And the same thing with the causative organism. So there are common causative organisms. And that's basically it. This was a very quick introduction to the treatment of meningitis, and in future videos, we're going to be talking about the actual specific organisms and their specific treatment in terms of drugs. So that's it. Thank you for watching.